Colorectal conditions are often fraught with misinformation, embarrassment, difficulty to talk about things. Let's break down some of those myths and talk about truths. First big myth, hemorrhoids always require surgery. That's actually not true. Most hemorrhoids can be treated with a change in diet, high fiber, increasing your water intake, and as we say on Dr. Do, your colon likes motion. Myth number 2, colon cancer only affects older people. Well, we know that's not true. Colon cancer is on the rise for patients that are under 50. That's why we now say the screening age for your first colonoscopy is 45. Myth number 3, rectal bleeding is probably just hemorrhoids. That's no longer considered to be true. We used to believe that if you had a young patient in your office, they had bleeding and you saw some hemorrhoids, but not a big smoking gun of hemorrhoids, we would chalk it up to hemorrhoids. But even the ASCRS, the American Society of Colorectal Surgeons, has changed their guidelines. Another big myth as we get scrubbed in for a colorectal cancer operation is that colorectal cancer surgery always means an ostomy or a colostomy bag or an ileostomy bag. That is not true. In the modern era of minimally invasive surgery, chemoradiation, other techniques by oncology, we find out that an ileostomy or colostomy is very, very rare. We can put people back together in ways that we were never able to before, thanks to minimally invasive surgery and better visualization and even stronger oncologic technique, which means how we do great cancer surgery. And now for one of my favorite myths. Bowel leakage or accidental bowel leakage or fecal incontinence is a normal part of aging. It is not. With new techniques like sacral neuromodulation, we are able to restore function and stop you from embarrassing leakage, giving you confidence and the ability to go places that you always wanted to go and live your life on your terms. So guys, as we always say at Dr. Do, your number 2 is our number 1.